One question that I often get is how can I support my loved one who has been diagnosed with schizophrenia? Where would you start?
So education, to just educate yourself, learn everything that you can about the diagnosis of schizophrenia, and understand what your loved one's experience is. Find opportunities to connect with other individuals who have a diagnosis of schizophrenia. Find opportunities to connect with other families who are experiencing schizophrenia in their family, other caregivers. And I think from the get-go, and as a psychiatrist, you would certainly agree with this, get involved in care early. So this would be, following diagnosis, which is a very confusing and difficult time. Everyone's experience is different, but I think we can say generally it is a very difficult time. And so for you to be that, ballast, if you will, for the individual that you're caring for, or, being a member of being on their caregiving team, it's important for you to know everything that you can about schizophrenia, about how your loved one is experiencing this challenging mental health disorder, and to be the voice, if you will, because there may be times then that your loved one can't necessarily advocate for themselves.
You mentioned education at the very top, and I think that's so critical. And if we think about how we talk to the caregivers, the family members about what might happen, because of course there's no one size fits all progression of schizophrenia. And so, how do you talk to caregivers, and how should we be talking to caregivers about expected symptoms and the progression of the illness and maybe hospitalization? How should we talk to caregivers about those topics?
This is a lifelong illness. There isn't a timeline that's clean and neat. And as you've pointed out, everyone's experience with schizophrenia is different. There are some things that we can say generally. And our goal, being a member of that caregiving team, is to help that individual recover and get back to their life as it was, as much as you can. So listening and understanding what the experience is, and then listening and understanding what that patient's goals are. What are their goals? Were they newly diagnosed while they were a sophomore living in a dormitory in an urban setting? Does that make sense for them to return to that environment? What changes are necessitated? Maybe none, and wouldn't that be wonderful? But most likely, until get to a point where we have an understanding and things get a little more stable, if you will, adjustments will have to be made. But I get back to what is it that our loved one desires? What are their goals? And then you can understand then and be that voice for them with their healthcare team, their mental health care team.
You said something that I think is so resonant. Be present. Because it will be different. And as we are educating our patients and those who love them and are caring for them, sort of making sure that they know that it won't be a straight line to recovery, and that is a lifelong illness, and there will be bumps in the road, and just being present in the moment while appreciating the course ahead.
Yes, and celebrating and acknowledging the successes along the way, because there will be challenges and there will be things that maybe don't work. And so often that's what the focus can be is, oh, that, that particular medication or that dose or this approach or that group that I participated in, the things that may have been wrong, but what were the things that were right? And being positive and, again, focusing on a return as much as we can to what normal functioning for that individual and recovery.